I'm Dr. Saleh Al-Messabi. I am coming from United Arab Emirates, city of Abu Dhabi, and here I'm attending the Centurion Council meeting 2017. It's really one of the best meetings ever to be attended. It's very informative, educative, and usually whenever I come here, I leave with a lot of messages that I can implement in my practice from the second day. Well, if you want to discuss the difference between active fluidics versus the gravity fluidics, is really a big difference. The active fluidics, the system really gives you a mind behind the whole process of the phacoemulsification, where it will be implementing certain parts in the procedure that possibly before we needed to calculate it or to put it into consideration by different factors. No, now the system with the active fluidics will be compensating for certain steps of the procedure in a way to make it really easier, faster, and more efficient, adding values of the lower IOP, adding the values in order to save obviously the optic nerve and saving the structure of the eye internally, while at the same time we are implementing the vacuum or certain phaco-dynamics to a very high level, yet maintaining the same efficiency, the same safety that you used to have before, with all the added value of the active fluidics. Well, considering the balanced tip versus, I used to be using a 45 mini flare Kilman tab in the past. Honestly, the shifting was very simple, very easy, with a lot of common sense to be there. So number one, just to let you know, I stopped using any intelligent phaco or IP even during the procedures for any dense cataracts, because the designing of the balance tip itself maintained all the way through the shaft and the internal diameter 0.57, and that allows us to have all the even the very hard nuclei to be emulsified without having to add a longitudinal or the standard phaco as it used to be in the old days, and just counting on the torsion or the amplitude. That was more than enough. This is number one. So no more longitudinal phaco is needed, or the intelligent phaco IP is needed, at least in my practice, for dense cataracts. Number two, I can still appreciate the quality of the cornea and the clearance that you're getting in the post-operative day period, especially the first few days, where you really want to get a trust from the patients by seeing a good results and very fast compared to the others. So the phaco-dynamics and the stability added as well, partially by the balance tip with the sleeves and with the all the parts related to it. It really added in the quality of the post-operative results and in the patient satisfaction. Well, if you want to compare the balanced tip 30 degrees versus the 45, in my hands and my preference is I would always choose the 45. The reason for that is, number one, I've been using that for a good few years, so there's really no changes in my practice, or at least in my hands, versus the Kilman 45 in terms of the beveling type. So this is the same thing I've been using. The other thing which is important is the more you go with the 45 versus 30, then you're having a better cutting capacity or strength or ability versus the 30, yet you are having also a better holding force, because you are increasing the surface area at the barrel tip or at where the beveling is happening, and that gives me a better holding for the nuclei when I'm trying to emulsify it. Obviously you need to respect that pattern when you are holding the piece, and that's something obviously all my colleagues know, that you want to have the highest or the biggest surface area to be facing the nuclei, so you can really move it smoothly from underneath the anterior capsule toward the center of the nucleus where you are emulsifying your nuclei.